There are 92 new COVID-19 cases in the community reported today. Of these, 80 are in Auckland, 2 are in Waikato, 1 in Northland, 5 in the Bay of Plenty, 1 in Lakes DHB, 1 in Nelson Marlborough, and 2 are in Taranaki. We are also advising of 3 additional cases in Taranaki who are known contacts with an established link, bringing the total number of active cases in the region to 5. The cases are self-isolating across 3 separate households in Plymouth, Rotorua and Waikato. On the advice of the local health unit, public health unit, Devon Intermediate School in New Plymouth has closed today after it was linked to one of the cases. Close contacts associated with the school have been identified and testing is underway. Case interviews are ongoing and any further locations of interest will be published as usual on the Ministry of Health website. With regards to hospitalisations, there's been a decrease. We have 79 people in hospital with COVID-19, including 4 people who are still being assessed. 9 of these patients are in ICU or high dependency units. On vaccine, very pleasingly, we can advise that Waitemata and Canterbury have now become the 3rd and 4th District Health Board areas after Auckland and Capital and Coast to reach 90% fully vaccinated. Also, the average across Metro Auckland DHBs has now reached 90% fully vaccinated. That's fantastic progress. Tamaki Makaurau has borne the brunt of the Delta outbreak, and its people have been the vanguard of Aotearoa's vaccination efforts. Really want to thank all of our health providers and all Aucklanders across the region. They can all share the credit for reaching those fantastic milestones. On My Vaccine Pass, the Ministry has now issued more than 3.25 million My Vaccine Passes. Again, that's a mammoth effort in just over a fortnight, and I'd like to thank all of those involved, including, of course, those who have downloaded theirs. It means nearly 90% of all vaccinated New Zealanders now have their passes. Additionally, more than 370,000 international vaccination certificates have been issued so far, with those numbers continuing to climb. While many of us are looking forward to greater freedoms under the COVID-19 protection framework, we must remain vigilant. Today we are reporting unexpected detections from wastewater samples taken in Matamata on the 29th of November and Gisborne on the 1st of December. Follow-up samples are underway. Our advice remains, if you have symptoms, no matter how mild, please get tested, even if you are vaccinated, and remain isolated until you return a negative test result. And finally, I'd just like to remind people to please keep scanning in or manually recording where you've been. Yesterday, there were nearly 3 million scans across the country. This will be more important than ever as we are now in the COVID-19 protection framework. To put it simply, our everyday essentials are mask, pass, and scan. It is these things that will enable us to enjoy summer whilst we continue to live with COVID on our own terms. Back to you, Deputy Prime Minister.
Thank you very much, Dr McElnay. As all of you are well aware, New Zealand has now switched into the COVID protection framework, or as it is becoming well known, the traffic light system. We were able to make this move because we have come through the past almost 2 years of COVID in better shape than many other places in the world. We've had amongst the lowest case rates, hospitalisations and death rates in the OECD. As we head into this next phase, critically we do so with high and rising vaccination levels. Of the eligible population, we now have 93% with a first dose and 87% with full vaccination. Of the remaining 5 DHBs still to reach 90% first dose, the Lakes DHB has just 785 more vaccinations to go, and the West Coast DHB 284 to reach the target, with a big push that could be done in both of those DHBs by very early next week. I do want to pause here and thank all New Zealanders for their actions to keep them, their families and their communities safe. Some people have tried to portray us as a divided nation on vaccination, The numbers simply do not bear that out. Getting 90% plus New Zealanders to agree on anything is a highly unusual achievement. We have come together once again to do this mahi, and we should be very proud of the progress that we have made. It is, of course, early days for the framework and the vaccine pass system that is intrinsic to it, and we can expect that there will be a few teething problems over the next few days. It is hard to remember back to the beginning of the alert level system, but the same thing occurred then too. We will be constantly monitoring the settings and making tweaks as necessary, as we did the whole time we were in the alert level system. And again, here I want to thank businesses for their cooperation in getting the vaccine pass system going. And I want to make a request to those of you who are out and about this weekend to please be kind and respectful to staff who are checking passes. They're doing their job, and we are all learning as we go. Just a couple of numbers here to reiterate what Dr. McElnay has said. As at this morning, we have issued 3.25 million MyVaccine passes, including 250,000 just yesterday. As indicated by the Ministry of Health last night, 54,500 individuals were issued an exemption email because their service request had not been resolved. I can tell you that 99% of those emails got through and 94% of them were opened. There will be a second run of those emails tonight to cover those for where there were issues with the emails, and that will cover all those with an outstanding service request. I want to remind businesses that the 8th round of the wage subsidy is still open for applications, even though we are now in the new framework, and applications for this round will close at 11:59 p.m. on December the 9th. The resurgent support payments numbers 4 to 6 remain open for applications through until the 13th of January next year. And also the transition payment, which I announced on Monday, opens for applications from the 10th of December, next Friday. This payment is a recognition of the long period of time businesses in Auckland in particular have spent with restrictions in place prior to shifting to the framework. The payment is designed to support those businesses through the next few weeks, and we encourage you to apply via Inland Revenue from the 10th. This transition payment is at a higher base rate than the current RSP, which will be $4,000 per business plus $400 per FTE up to the cap of 50 FTEs, a maximum payment of $24,000. And as I said on Monday, that is estimated to have a total cost between $350 and $490 million. The affected revenue period for the transition payment will be set between October 3rd and November 9th and will be compared to a typical week in the 6 weeks prior to the 17th of August. Finally, before we go to questions, I have the pleasure of letting you know that this will be the last Friday 1 p.m. press conference for the year. Obviously, there will be others through next week, but not next Friday. I want to acknowledge that 2021 has provided significant challenges for many people, but also further evidence of the resilience, compassion and resourcefulness of New Zealanders. And that applies to all of you in this room. I want to thank you for your hard work in disseminating complex information under huge time pressure to ensure that New Zealanders remain well informed through this pandemic. While we might not always agree on what comes out the other end, this has been an enormous and exhausting task that is vitally important